Hi there, Kemmet FM. Now, this week is HS Awareness Week, and I'm going to leave the pronunciation to my guests. It's a condition that affects around 1% of the population. It's a chronic and debilitating skin disorder which can cause painful abscesses and nodules, boil-like lumps on the skin. So, joining us today, we're joined by the founder of the charity, the HS Trust. That's Tara Burton. Good morning.
Good morning.
Linda Murray, who was diagnosed with HS 15 years ago after misdiagnosis. Good morning, Linda.
Good morning.
And clinical nurse specialist at Guy's and at St Thomas's Hospital, Deborah Brown. Good morning, Deborah.
Good morning.
Now then, I've been a bit of a coward, not pronouncing HS. Can you pronounce it for me and tell me what the condition's about?
Yeah, sure. HS is short for hidradenitis suppurativa. It is a disease that affects the skin, and as you mentioned yourself, it causes boil-like lesions that manifest itself in warm areas such as the armpits, under the breast, the groins, the buttock, the pubic areas, the inner thighs. These lesions very rarely heal, so patients are often left with open wounds that's extremely painful to endure and is often endured on a daily basis. So obviously the impact on a patient's quality of life is extremely detrimental. It's extremely embarrassing to suffer from, and obviously it can cause problems with peers and relationships and careers and what have you. It's an extremely under-knowledged disease around all medical care as well, which is sad, but obviously that's what we're here to try and increase the profile of.
Yeah, I actually looked it up. I went and Googled it yesterday. And there's some photographs on the net, and it's just absolutely horrendous. I mean, it must really affect people really badly, particularly in terms of embarrassment as well.
Yeah. Sorry, it's Linda here. Very much so. Impacts massively on your daily lives, relationships, personal relationships, even relationships with your family, because, people arrange days out. You have to think about things before you can even arrange that, what with dressings and the different clothes you wear. You don't want to go out because of the embarrassment, especially somewhere like the seaside, especially in this weather, with the scars and everything. But you have a very, very low self-esteem that leads on to depression, mobility issues, the pain every day, chronic pain. Yes, it does affect massively.
So you were diagnosed 15 years ago. How did that start for you, Linda?
Well, I was about 38 years ago. I was treated for acne, and I was told, "Oh, it's acne. You'll grow out of it. It's your diet, etc., etc." And I was treated with numerous antibiotics and things like that. And I just sort of went along with it because no one had heard of HS. But it wasn't until about 28 years ago that I was finally diagnosed through a local hospital, and had since had an operation on my arms, underneath my arms and things like that. But it wasn't until a few years ago that I came across the hs.org website and the support group that they have there. And it's felt like a light bulb moment. I thought I was the only one. I felt so alone. I felt isolated, and no one had got what I've got. It was very misunderstood. And outwardly, you look fine. When you've got your clothes on, you look fine. People look at you as if there's nothing wrong with you, but they don't understand the severity of it. It affects your work life. I've lost many a job through having to have time off work because people don't believe you. You can't, show your managers what's wrong with you, and they think you're just sort of playing around. So, yeah, it affects greatly on everyday life.
And why do you think that HS is such an unknown condition?
Well, there is a general lack of understanding by the public, and especially in primary care, of the disease process. Because of this, as a matter of fact, the average time to diagnosis is approximately 8 years.
Which is a long time.
It's horrendous.
So, why do you think it's so often misdiagnosed? Is it because, as Linda was saying, she was treated with acne and...
Well, as Linda pointed out, the disease process has a very insidious beginning, and it mimics other skin conditions, such as acne or individual boils or abscesses, or even skin infections. And that contributes greatly to this lag time in a definitive diagnosis. As a matter of fact, HS was actually discovered by Dr. Velpeau in France in 1833, so we really don't know what happened between 1833 and 2016.
Yeah, where's that information gone? And I suppose because it affects the groin and under the arms, and I've seen photographs at the back of the neck, people think that it's to do with ingrowing hairs as well?
No, and one thing I really want to emphasize is that HS is not caused by poor hygiene.
Yeah. Yes. So what can we do to raise awareness and better understanding of HS?
Yeah, well, this week is HS Awareness Week, running from the 6th to the 12th of June. And the main issue surrounding HS is the lack of education. So we are trying to raise the awareness, increase the profile, and just to get the name HS out there, hidradenitis suppurativa, to make people known of it and that it exists and that it is an issue in society. One issue that we have is with primary care and the lack of education in primary care. So that's one area that we really need to push. But also having more resources where patients can go for help, and also just allowing carers of patients with HS so that they know what their loved ones are going through and what they're dealing with as well. So we are using this week to run events, increase the profile of HS, have blue days such as today. So if anybody wants to wear something blue or paint their nails blue, dye their hair blue, just to have a bit of fun with it, get HS out there and take away the stigma that's attached with it so that patients know that it exists. And the main issue is that they don't have to go through life alone.
Yeah. So it's got nothing to do with poor hygiene. Just run through the signs and symptoms again for our listeners.
Yeah, sure. The disease manifests itself in boil-like lesions or abscesses. The most common areas are under the arms, under the breast, in the groins, the pubic regions, the buttocks, the inner thighs. One key issue is that these boils will recur in the same place. They have to be recurring, and they do discolour the skin and they cause scarring. The wounds take longer to heal, sometimes not even healing for years. Constant dressing, and of course that leads to constant pain. My one piece of advice would be that if you do have boils that recur in the same place, please go and visit your GP and insist on a referral to dermatology where they actually know skin disorders, and if it's a recurring issue it needs to be dealt with by a consultant.
And where should our listeners go for more information?
Yeah, the HS Trust has a website if they'd like to go and visit hstrust.org. There they can find disease information and patient support, and they'd actually have links on there to either online support or they can go to groups that are listed there as well for help and advice.
Hidradenitis suppurativa.
Oh, well done.
Well done.
Ladies, thanks a lot for joining us.
Thank you very much. Thank you.
Bye-bye now. Bye-bye.